When we're talking about full mouth implant reconstructions, we're talking about a treatment for a group of people who completely have no teeth. They lost all their teeth, whether they lost it because of a gum disease, trauma. These are the patients that will require full mouth implant rehabilitation. There is a lot of different options when we're talking about full mouth implant reconstructions. We have to think about it like this. You can either have the options of the removable appliance, and for that you need fewer implants, like 2 or 4 implants on each jaw. The job for the implants is just to help in the stability of the dentures. The other options will be to go completely fixed appliances that they are bolted, they are non-removable, and they will stay in your mouth day and night. For those bridges, we are looking at either completely made out of porcelain or made out of porcelain fused to high noble alloy, or in a mixed material, which is, we call it a hybrid, and they are denture teeth bonded to the metal. So there is a lot of different options for different budgets and different needs. And this is why I ask all my patients to have a complimentary consultations where we can sit down and we can go over all their different options after a very detailed exam.